Hi, everybody. Dr. Joe here, and for today's patient files, we are going to be talking about a golfer with the lower back pain. Just a quick reminder, patient files are stories from me about patients I've seen and who have been successfully treated, and I'm going to convey their story to you in hopes that you can solve the same type of issue. So if you're a golfer, I am sure back pain has inevitably been part of your golf career at some point. Almost everybody faces it. Sometimes it's short, sometimes it's long, sometimes it's off and on. But in this case, the golfer I was working with was probably about late 30s, early 40s. He had lower back pain. It was during golf. It seemed to be tied most to putting. Now, he did have back pain with some other things, which can add some confusion. He did occasionally have it bothering him during full swing. But the more we talked about it, the more it seemed like the genesis was actually from putting. He had been working more on his putting lately because it was a part of his game he struggled with, um, and it seemed like that's when it was worse. If it bothered him during full swing, it was usually after he putted. So we wanted to work backwards, and we measured all the normal things. His flexibility was okay, maybe a little below average, but not terrible. Certainly not a lack of flexibility I would associate with being a problem for putting. His strength was actually quite good, so he measured well there. Overall, um, his movement, his control, those were also pretty good. But what we found were deficits in his setup and execution of his putting stroke. So something I'm constantly telling clients is that it doesn't matter how strong you are, it doesn't matter how flexible you are. If your mechanics are off, then you're going to put stress in places it shouldn't be. And if you do that repeatedly, it's going to cause things to get irritated. So in his case, it looked like the genesis of the pain was mostly from facet joints. So what he described to me was kind of a dull ache that was almost constant. It would feel worse during putting, get a lot of fatigue in his lower back muscles while he was putting, and eventually that fatigue would start bleeding over into pain in the lower back. When that pain got bad, he would get discomfort. He would get a little bit of tightness during putting, but the real problem was after he finished up, it just seemed like everything seized and tightened up like crazy. So naturally, we took a look at his putting stroke. I kind of have an analysis I do of golfers and their putting strokes. I'm going to link that video. You'll see it on your screen now. I'll also put it in the description of this video in case you want to check against yourself. But we're looking at things like where is the center of gravity? Where is his balance point? Because if that balance point falls forward, which it did in his case, it actually puts more stress and more work on the lower back muscles. Where is the posture? Where is the neck position? Is the hinge and the setup posture proper? Is he free enough from the thoracic spine to make a smooth stroke? Where is his eye level? How is he hitting the stroke? All of these things factored in. So we went through that whole analysis, and we highlighted about 2 to 3 points on it that were the biggest issues. And that's where we went for a solution. So he had actually previously seen some others to try and get a solution, but the problem was they just asked him to do a bunch of stretching and flexibility work. Again, he could definitely use that flexibility work, but the genesis of his problem was not actually the flexibility piece. It was really the setup and the mechanics of the stroke. So that's where the solution had to be. So we worked a lot on his hinge patterning. Actually ended up helping his full swing, which is great too. We set up a lot of his hinge patterning. We did a drill where he was essentially standing up, and he would push his butt back, trying to contact the chair, and his chest would drop forward. And what we wanted to see with that was that the amount of movement from his butt back was matched from the amount of movement of his chest and shoulders forward. So anytime we shift the body weight, we're going to shift the center of gravity. So when he was going into his putting stroke, his shoulders were dropping forward. The problem with the shoulders dropping forward is that puts a lot of leverage on the lower back unless the butt moves back to counteract it. If you stand up, you can try that where you are, and you're actually going to feel that difference in the lower back. That was a big piece of his. We also needed to narrow down the posture piece. We wanted to get his spine in alignment. He actually had a little bit of neck discomfort too, which was taken care of as we ironed out the rest of the spinal alignment. We also looked at his setup to the ball and just made sure that he wasn't overly reaching for it. Wanted to make sure his center of gravity wasn't out front in his toes, nice and centered through his feet. This was pretty cool because he went and he made these adjustments and noticed some benefits immediately. His back pain didn't go to zero, but it dropped down significantly. And then as he got more repetitions on it, more time spent ironing out the form, it did eventually dissipate his back pain. And again, actually some of that carried over into the full swing, which not only took away some of the discomfort he was experiencing sometimes in the full swing, but actually helped his ball contact. That's a different story. But that just has to do with the consistency of the movement when you put yourself in an optimal position to start. So that's a golfer with lower back pain, mostly driven by putting. So if that is your issue, then this was probably a good video for you to watch, and I would definitely recommend that you go look at the other video I referenced as well, because that'll walk through the analysis setup of the putting portion, and hopefully it can help you solve your problem. If you have questions, drop them in the comments below. I also do virtual online assessments if you are having any of those issues and you want me to run a video analysis on it. Thanks, and hope you learned something.